Now, Nigeria is currently dealing with a deadly cholera outbreak that's claimed at least 53 lives, with more than 1,500 cases reported in 31 states, a number that could potentially rise even further. The Nigerian Center for Disease Control has ordered more vaccines for the country because of the scale of the problem. On Monday, it activated its Emergency Operations Center nationally to create a system where the response activities can be coordinated from a central level. And anyone who has the disease is being treated free at public health facilities. So, after decades of progress, why is Nigeria seeing a countrywide upsurge in cases of cholera? And what are the possible public health consequences? Well, for the very latest, I'm joined now in the studio by the Deputy Director of Surveillance at the Nigerian Center for Disease Control, Dr. Muntari Hassan, who is also the National Incident Manager for Cholera at the Center. Thank you very much indeed for coming in.
Thank you for having me.
What's the current number of people who've died from this latest outbreak of cholera?
So the current number of people that died are 54 right now.
So it's gone up from 53?
Just, one. Yeah,
right.
It's gone on from 53. And the total number of cases that we have today is 1,579, cutting across 32 states of the Federation and covering 115 local government areas.
So it's getting worse, not better?
Yeah, so in terms of when you look at the number and then when you look at the death, you understand, you can say it is getting worse. But when you look at the total number, total number of reported cases, suspected cases, it is this week of 25, it has reduced from what it was in week of 24.
But it is still getting worse. It's not getting worse.
Yeah,
in other words, I understand what you mean, that the overall number by which it accelerates has reduced, but it's still accelerating.
Yeah, but we are still having cases across the country.
Right. So what does it mean to activate the Emergency Operations Center?
Okay, so what it means essentially is we have, Nigeria is a cholera endemic country. We have been having sporadic cases all through the year. But when cases rise, or we have upsurge in cases, then there is concern, which prompted us to conduct what we call dynamic risk assessment, and which we rightly mentioned that Nigeria was ranked, we ranked, Nigeria as high risk. So once we rank Nigeria high risk, then there is need for us to have a coordinated structure where we can have a multidisciplinary, multi-sectoral response to any of the epidemic-prone diseases, not only cholera, well, in this case, cholera. So the Director General, Nigeria Center for Disease Control, Dr. Jide Idris, inaugurated an emergency operations center yesterday, and appointed an incident manager for the response. So the essence for this is to have, as I said, a well-coordinated response, because this emergency operations center comprises of the NCDC, the other ministries, department and agencies like Federal Ministry of Health, Federal Ministry of Environment, Federal Ministry of Water Resources, and partners that really are supporting, for example, World Health Organization, UNICEF, MSF, that's Medicine Sans Frontier, International Federation of Red Cross, among a host of others. So they are all there. This response is really a multi-sectoral, response. So that's the essence of inaugurating an EOC.
Right. So why is cholera still a big problem in this country?
Thank you very much. I think that is a very important question that we actually need to confront, both as, especially at the state level. The reason is that the factors responsible for, bringing about cholera infection are still there. For example, the most important aspect that we have to consider is issue of water, sanitation, and hygiene. And if you look at potable drinking water, the availability, especially in rural areas, if you look at how hygiene, the habit of hygiene, even for people that have gone to school, you find it very difficult for somebody to do something and regularly wash his hand and the way it is supposed to be. You understand? And then sanitation. You see littered environment, waste disposal is not being carried out the way it should. So you will see that water is being contaminated. For example, when we look at that, you see that there's open defecation. In Nigeria, we have a lot of open defecation, and this thing happen mostly in the states. So if we don't tackle this issue of water, sanitation, and hygiene at the state level, in this case, what I'm saying is that we have adequate budgetary allocation and we have releases of these budgets, to be able to carry out these interventions. And it has to be persistent or consistent, not to do it this year and then, abandon it. Because even if a state is open defecation free, there's nothing wrong, there's nothing that will prevent it from coming back as open defecation. You have open defecation everywhere in the state if measures are not taken. So essentially, to answer your question, is issue of water, sanitation, and hygiene. But if we have the cases, for example, right now, then there is issue of what we call looking for the cases from the community. That's, we have to intensify surveillance, and then we have to also intensify the confirmation, that is laboratory confirmation. And we have to also make sure that we have a very good, standard cholera treatment center or cholera treatment unit, or even oral rehydration point where you can give people some. So I think that's...
So it must make your job really difficult then, because I mean, it's like returning over and over to the, Groundhog Day, returning over and over to the same spots, because your job is to deal with disease, but you will also need to educate, be sure that people are educated, but you can't do it all. You have to depend on the state governments and so on to say, you need to improve your supply of clean water and all the rest of it to minimize the work that you've got to do.
Yeah, so to be frank, Federal Ministry of Health, where Nigeria Center for Disease Control resides, is doing a lot to ensure that not only cholera, other epidemic-prone diseases or infectious diseases or priority diseases for that matter.
Yeah, but if you don't have clean water, and you have filth all over the place, and you have open defecation, then clearly you're not doing enough.
Yeah, sure. So I'm coming to that. Is doing a lot to make sure that, because there are policy documents that guide the states, in making sure that this is what you should do.
Yeah, but they're not doing it.
Yeah, so what I'm saying, the first thing is you have this document that will guide you. You don't have any excuse. The second thing is, in terms of water, Ministry of Water Resources, they're doing a lot. Federal Ministry of Water Resources, I'm not speaking for them, but I know that we are working together. It's a multi-sectoral. I know what they are doing in terms of seeing that they establish or build some boreholes or provide potable drinking water to some communities. But as I said, there are a lot of things that the state need to do to complement, or the federal government is for complementing the state.
But also on a personal level, there are a lot of things that individuals need to do, isn't it? For their own personal hygiene.
Definitely. So, in fact, that is what I want to even speak about, because in most cases, it's not really the government. There are certain things that we don't need money to do. For example, washing our hands. Do we need to be paid, or do we need to pay money to wash our hands? Having a pit latrine or a water closet system, do we need, if you have a house, then you are expected to have a place where you can dispose of all that. So our own personal commitment as a populace also matters a lot, because we need to really be committed. Yeah. We need to, if you have water and you know that it will cause probably cholera, then if you take it, try and boil it. And store it. It's for your own consumption. But we have that habit, that if something doesn't happen right now, we may not consider it as very important. Yeah. So I think that is
so which areas are most affected? You said there are at least 32 states now affected by this, but
Yeah.
which are the areas worst affected?
Okay. Right now, the worst states that are affected are Lagos, Bayelsa, Abia, we have Katsina, about 6 top states that I can say they are worst affected. But
Right.
basically, the ones with the highest number is Lagos and Bayelsa states.
So basically, the biggest challenge for you is how to break the transmission in a country where there is limited access to clean water.
Yeah, so that is one of them, because it's a multifactorial
Right.
problem. It's not, we can't single out just one problem. For example, we may have potable drinking water, but somebody is defecating in the open and he has cholera, and then it rained and it washes and they come to contaminate your surroundings.
Right.
And then somehow you contaminate either your hand or your food or something and you have eaten. But you have potable drinking water.
Right.
So you see, that one is also another problem, issue of sanitation. But important and simple is issue of washing hand. Once, even if you don't eat or drink from contaminated food or water, you understand, and you touch something that you couldn't even wash your hand, you can get cholera can be transmitted.
Right.
Somebody can be infected with cholera. So essentially is a change of attitude, habit of people. What do we need to do ourselves?
Right.
Then we look for support from government.
So it requires education.
It requires education. So
Right.
that is why also we have developed some jingles, you understand, that we distribute to states, and other community engagement practices that we want to enlighten people. Look, this is for your own good. This is just the simple step that you need to take to prevent yourself from cholera.
And I mean, obviously, education is a medium to longer term thing. I mean, although it may actually work also in the short term, because when people are confronted with very stark realities of what is happening, it might shock them into action. But in the immediate term, are you supplying people with things like purification tablets? Is the government providing water, mobile toilets in sufficient quantities to mitigate in the short term the problem?
Yeah, so as I said earlier, this is a multi-sectoral approach. For example, if you are talking of water, then we will now look at the Federal Ministry of Water Resources. If you are looking at anything to do with environment, particularly in terms of sanitation, exercise, and all that, it's Federal Ministry of Environment. But we as NCDC, we intervene.
Yeah, but you said you've got a coordination.
Yeah, coordinator. So that,
and so presumably,
presumably. So they are all doing that.
You'd be advising
in the
people
exactly.
and so on about
so
what to do.
they are all doing that. Environment and Federal Ministry of Water Resources are all doing their parts. So the parts that we also, as NCDC, we try to work under about 8 to 9 different pillars. The first one is issue, as I mentioned, of coordination and leadership. Because if you have multiple partners supporting, going to states, without being coordinated, you are going to waste resources, duplication, and all that. And the second thing is you support the states in terms of technical support and even material support in terms of looking for the cases in the community. For example, you'll be able to send what we call rapid response team to the states to be able to support them in terms of looking for the cases in the community. Because if you have one case in the community, it can infect other people. So if you remove that person and take him to a treatment center and isolate that person and make sure that he's treated, he's cured, then that community is fairly safe. You will only deal with the immediate contacts of that person. And then in the area of case management, we also support the states in establishing or making sure that there is a standard, what we call cholera treatment center or cholera treatment unit, that is smaller component type of it, or even oral radiation point, because cholera is essentially, people are losing water. So if you lose water and it's not replaced, that is where the danger is. But once there is oral radiation point, before somebody is taken to hospital, he's treated there, so he's stabilized. You understand? So that is another way whereby, and then essentially again, Nigeria Center for Disease Control, because it knows that this cholera is endemic in Nigeria, we have done what we call preparedness. There's a preparedness checklist that all the states have filled.
Right.
You understand? So that we'll be able to know what level of preparedness they are.
Right.
And we have developed what we call emergency preparedness and response plan in the states.
Right. So, I mean, the upshot in all of this is whether Nigeria has the capacity to adequately deal with this issue.
I believe Nigeria has the capacity. I believe Nigeria has the resources. I believe Nigeria has the capacity.
Right.
Especially in terms of working together with other development partners to solve this scourge of.
Right. So just remind us very briefly how a person gets cholera.
Okay, very briefly and very simply is once somebody ingests water or food, you understand, that is contaminated with the vibrio cholera, he may get cholera because it all depends on the immune system, your level of immunity. You understand? So it could be from 2 hours to 5 days, the incubation period, when somebody can come down with. And many people are infected with cholera, but they don't present with the symptoms. Their body takes care of it. But those people that are not lucky, or their immune system is compromised, or simply they can come down with.
And of course, it can be fatal.
Certainly, it can be fatal within hours. If nothing is done, especially if you have spurious, watery diarrhea, within hours, somebody can lose his life. So it is something that is treatable and is preventable.
Right.
So it is something that can easily be taken care of. Ideally, nobody should die of cholera.
Right. So if somebody catches it now, the advice is to leave them and not get into contact with them or take them to a hospital?
No, so because the problem is that number one, you cannot know whether that diarrhea is even cholera.
Right.
So it has to be, taken care of by a competent or qualified, personnel in the hospital. Now, if we have an outbreak, that's a different issue. But if somebody just come up with, then he has to go to hospital, and then he's consulted, and then maybe samples taken, and then you make a diagnosis. But if he's in the community, for example, if that person, when the diagnosis is done and we realize that it's cholera confirmed, then in that community, anybody that comes with symptoms, what we call standard case definition or community case definition, depending on, so we just take, that's why it's important to have established cholera treatment centers.
Right.
That once you have the outbreak, you know that this is cholera, you just take them separately.
And you have that?
Yes, we have that across the state, owned by the states.
Right.
Yes.
Okay.
Yeah, but they may not necessarily be adequate.
Right.
Yeah.
Or but at least it's a place they
yes,
can
but
go
there's
to.
a place that you take.
Okay. Well, we've got about a minute or so left. What's your message? I know you kind of touched on that earlier, but what's your message to Nigerians? What's the alert that you're putting out to them?
So the alert I'm putting out is that, number one, as you rightly mentioned, we, the Nigerian people, should take this responsibility in our own hands.
Right.
Number one, we take care of ourselves in terms of hand hygiene or environmental hygiene, sanitation, making sure that we don't defecate in the open. You understand? So, or even if we shouldn't defecate in the open, then we have potable drinking water. Even if you don't have that, you make sure that whatever water that you are drinking or using to cook, you should be able to boil it or chlorinate it or do whatever that is standard that you should do. So that is number one on the part of the Nigerian populace. Then number two, we have to intensify effort to have more investment, at federal and the state level in terms of wash infrastructure. And then even for example, I was telling you, we had a preparedness, assessment, and we were able to pre-position. We are able to procure commodities that are needed. For example, drip, IV fluids, drugs, antibiotics. That is important in the treatment of cholera. And once the season starts, we pre-position those commodities from NCDC to 22 states right now. So I think the issue is all of us have to take responsibility
Okay.
and fight this.
Well, thank you very much indeed, and we hope that you will stay on top of this. Dr. Muntari Hassan is the Deputy Director of Surveillance at the Nigerian Center for Disease Control. He's also the National Incident Manager for Cholera at the center. Thank you very much indeed.
Thank you.